of the acne, and that should be applied specifically. And then if you want to take it off, you should be using two type of cleanser. First, guys, I'm Dr. Haroon Rashid. I'm a dermatologist. Here we are going to discuss a very important topic of acne prone skin for its routine care, and then how to go for makeup. And then at the end of the video, I will discuss three important tips how to avoid breakup of this comedonal acne. First of all, in routine care, we are going to advise the patient to have a good cleanser. That should be mild one that will take away your fats, your debris, and the leftover of your makeup. That should be used 2 to 3 times a day. Then comes the exfoliant that should be having 1 to 2% salicylic acid or witch hazel that will take away the dead cells from your skin, and that depends upon your face how many times you can use it, 2 to 3 times a week. Then comes the toner, which reduces the oil flow and balances the pH of the facial skin to provide a better base for the routine makeup. Then comes the moisturizer. That should be a oil-free moisturizer that must be non-comedogenic. Mostly this hyaluronic acid is good out of that lot also. And here I want to clear a misconcept in many of the people that if the moisturizers are applied, face may get more oil and this and that. But it's not so. If you apply a proper non-comedogenic oil-free moisturizer, you are going to control your oil flow on your face. Then the priming of the skin, then during starting your makeup in the acne prone skin, and the primers that should be metallic preferably, and that should be pore filling to make a smooth base for your makeup. And primers, if sometime they may be having mild concentration of benzyl peroxide or mild concentration of salicylic acid, they are well enough to stop the breakout of the acne. Then comes the foundation. In foundations, these mineral foundations are doing well, as well as the BB creams are also doing well. They sometimes also have some benzyl peroxide or some anti-comedonal constituents, which help reducing the incidence of the outburst of the acne. Then come the concealers. Here are two types of concealer. One is green concealer that is usually used to conceal the blemishes of the acne, and that should be applied specifically on those points which are affected and red. And then comes the concealer of your general makeup. And then comes the layering. That should be very fine and neat layering. That should not be too thick, because it again will lead to the outbreak of the acne. So layers should be minimum, and that must be kept very thick. Then you can go for setting the makeup with translucent non-comedogenic powders are available to settle down your setup, your makeup. Now in such sort of people, the eye makeup is very important. It must be hypoallergenic. It must be non-comedogenic, so that this should not lead to the outbreak of acne around your eye. And the lip. On the lips, lipstick, balms, all that, they should be limited within lip skin. They should not spill over the nearby facial skin, that so that they should not lead to an outburst of the comedones or the acne around your lips. This is again very important. They should be limited only just where they are applied on the lip. So it's, then the setting sprays are available, and to set it on your face for the whole day. In this way, if you follow all these 7 or 8 steps, you are going to have a long-lasting, smooth and decent makeup for the whole day. And then if you want to take it off, you should be using two type of cleanser. First of all, there should be a salicylic acid 1% cleanser, and you should clean it off. Then should be a mild cleanser as a routine that should be doubly washed with the cleansers. Then I'm going to discuss a few steps how we can avoid such sort of outbreaks in such acne while you are going for the makeups. First of all is patch test. You can take a little of the material which you're going on to face and you can apply on your facial skin. That may be a diameter of 1 centimeter or 1.5 centimeter. You can look after about 12 hours. How does it go? You may try it 1 or 2 times. Then all the products to be used, you must go into the ingredients and should read about the details on the label. That should be non-comedogenic and all free. And thirdly, a very important advice, that the tools and brushes or sponges which are used in such cases for makeup, they should be washed very regularly, so that they should not be having lot of bacteria or and the fingers should not be used on such face for makeup. So because they will shift your bacteria and the oil on the rest of the area where you don't have the acne. Thank you very much for watching, and please share my video to the others, and subscribe my channel and hit the button of the notification. Thank you very much for watching again.